a production of the Mesa Chamber of Commerce. Visit us at mesachamber.org.
Thank you again. Michelle, do you have any updates for us?
Hi, I'm Michelle with Senator Sinema's office. I do healthcare outreach in northern and western Arizona. So basically everything except for like Pima County. There are no healthcare updates on the legislative agenda in the Senate anytime soon. Unfortunately, with the Build Back Better agenda, we don't really have a timeline on when or if that will proceed. But the senator does remain in contact with the White House and her Senate colleagues on her priorities in that piece of legislation. As I'm sure you are all aware, because you all work in the healthcare field, the CDC released new guidelines on quarantining. So if you test positive, you stay home for 5 days. If after 5 days you have no symptoms, you can go out wearing a mask for another 5 days. You have to wait till you have no fever before that qualifies though. So it's a reduction from the 10 days that it was previously. We're also hearing lots on delays in testing. So I think Embry, which is one of the largest providers in Arizona, is like 3-hour wait times right now. I know my older brother just had to wait 3 hours in Queen Creek, which isn't exactly one of their busiest sites. So if you are needing tests, it's very difficult to find one right now. The ASU Biodesign Institute does have saliva testing, and they do have quite a few appointments available. So if you have people reaching out to you needing testing, ASU Biodesign does have appointments available, a lot of times same day, because we know you also can't really find any tests in stores right now. We also can't find any tests. So as you can see, we are back to remote in our office as well. But if you guys have any questions or concerns about anything, please, I'll put my email in the chat box again for those of you that don't have it. You can always feel free to reach out to me and I will do my best to get any information that you guys need.
Great, thank you, Michelle. Appreciate the updates. Yeah, I'm hearing the same thing around the country as it relates to just testing and trying to get those tests. It's a hardship. I think the holidays had a little bit to do with the backlog in general, logistically, but fingers crossed we'll be able to get them out quicker. All right, moving on to number 3, Dementia Friendly Mesa Subcommittee. I know Sherry's on. She is a little under the weather from what I'm hearing. Hopefully she's doing okay. And Karen, any updates for the group?
Well, our last meeting was November 8th, and it was a very small meeting. But we did agree on some things for the Dementia Friendly Business Program. It's going to be free participation for businesses. And instead of requiring dementia champions, we're going to encourage dementia champions and provide them with a Dementia Friendly at Work program, and then go to an annual lunch and learn to keep them up to date for their employees. A lot of the other communities around the country had trouble enforcing that 50% of employees had to be trained. So we kind of softened it a little bit. Not that we're going to kind of let them off the hook, but we're going to encourage instead of mandate. And then they do have to sign a pledge or some kind of a commitment statement to become and remain dementia friendly. So I think we're going to look at what we need to look at is getting information on the Mesa Chamber of Commerce website, because there's nothing there that Mesa is dementia friendly. So that's a start, and then go from there as far as connecting to banner and trainings and all the things that we're going to offer this year. There's a couple of resource fairs coming up that we hope to be a part of if they still go forward, given the state of COVID. Lori's not on today, but she's got Sunland Springs Village and Sunland Village East both have some expos coming up the end of January, and then one in February. So we'll see if we can get a table at one of those events. And if there's anybody available to run that table besides myself, I've been called for jury duty, so I don't know what that's going to entail at the end of this month. So if we do have some volunteers, if you could let Sally or Sherry know that you'd be willing. I think January 27th was the first expo, and then February Sunland Springs Village, that's out at Signal Butte Baseline, was January 27th. And then Sunland Village East is February 16th. So if you.
Okay, so I have the dates wrong. So it's the 27th of January and the 16th of February.
Yeah, the same day as your
Yeah.
event. I guess you're having a big event, which we also talked about launching the program during your event on February 16th. So a couple of opportunities coming up where we can get out into the public if we're still doing that. And then we're going to discuss setting up a calendar for the year to when we expect to get the website done, the trainings, and so forth, and maybe setting up a quarterly calendar as to what our goals are going to be for the year.
Karen, it looked like Becky had raised her hand.
Yeah, I was going to say, I don't know how I missed the November 8th meeting. But I am very anxious and very supported by my employers to be, to do whatever I can to help move things along, because I know the holidays hit and COVID and everything, but we're so anxious to have this really get into Mesa, into the businesses. So I am more than willing, reach out to me anytime you need help with anything. More than willing to be part of this. I want to be part of it. So there's a lot of need out there. I work with helping a lot of families place their dementia family member. I know how emotional it is. I'm always amazed at how little education has gone on. So I really want to be part of this. I think Mesa really needs to embrace it.
Yeah, and I think we can do that through the website, because I know Banner's got some Dementia Friends sessions coming up, as well as the Foundation for Senior Living has some. So if we connect to more than what we can handle and let people know that, they're all by Zoom now, so it's not that they have to be in person anywhere. But thank you. And
I actually had a lady stop me. I was shopping at Superstition Mall right before Christmas, and she saw my name badge for the work I did, and was a caregiver, and I sent her to that site. She's going to become a dementia champion and help out too. So yeah, there's a lot of opportunities for us to get people involved. Just anxious to push it forward.
yeah, and Sally has the cards for the caregivers. And so anybody that wants the cards that the caregivers can take out into the public that say that they are with somebody that has some memory issues, and please be patient and so forth. So we're going to really push that as well.
Okay, and that's important too. I know of a family that used that with the doctor of all people because of how he was handling an appointment. So I'll get with you, Sally, and get those cards.
So I don't know if Sherry has anything, or Sally.
Sherry, did you have anything that you wanted to add? She said no.
All right, well, thank you for the update, Karen. Thank you for the discussion. Again, if you're interested, please reach out, let Sally or Karen or Sherry know, and we'll see if we can figure out times to get you to help out. Moving right along to the website content development. Sally.
Oh, yeah, so Karen just mentioned, we're working on a new website. So any information that we can get, if you all, because you're committed to this, if you'd like to send your logos over, we'd like to add, the logos for this this group, not of the group, but the members of the group, to our page, just so people understand who's committed to this. And obviously that includes our friends from PD and Fire. Hi, Tom, I saw you come on. Anyway, if Karen, maybe you can help me get some verbiage for the dementia piece, and then we can work on the other committees. And I don't see Todd on this call for the technology piece, so I'll reach out to him individually. Yeah, we need that content piece. So we're working on it.
Thanks, Sally. You mentioned I don't see Todd on either for the technology subcommittee. Is there anyone else that participates in that may have any updates? I'm looking at the list here.
Tom, were you part of Todd's technology committee?
Originally, yes, but I have not been engaged with him.
Okay. All right. I'll reach out to him and find out what else he's got going on.
Okay, great. Thanks, Sally.
Mhm.
Moving on to the COVID subcommittee group. Let's see. Has anyone participated in that group? Has there been any further discussion surrounding that? Just want to open the floor to the group.
So that was a group that Glenn was kind of spearheading, but Cindy might have some updates for us just on where we're at with COVID in hospitals.
Yep. So currently, as everybody knows, there really have been rising in Arizona as everywhere else. We actually have the most Dignity Health employees out with COVID that we've had. We're over 450 positive COVID employees at Dignity in Arizona. We saw 900 patients at our ED, just the Arizona General EDs in one day. That is a record. Generally, this time of year, we see about 650 to maybe 675. We're up to 900 a day. Staffing clearly is a problem across the valley for healthcare. And when you add our sick employees, it surely doesn't help. I can just say for Dignity Health, as far as like events go for us, we have been told by Common Spirit, which is our parent company, we're no longer allowed to attend in-person events for pretty much for any reason. We have to continue to do Zoom with the numbers on the rise where they are right now. So that's kind of the stance that our organization is taking in Arizona because the growth of COVID so fast. And then we greatly appreciated the drop in quarantine timeframe to 5 days, especially for asymptomatic staff, because as you know, having 450 employees out, it's really difficult to handle on top of everything else. And then having them have to be quarantined for 10 days, that was really a big struggle for us. I'm sure it is for all the healthcare organizations, you know, and fire and the ambulance crews as well. That's been very painful. So thank you, government, for helping us get that through. We greatly appreciate that. I think that's about all I have. I guess the only thing I would say is we are still highly advocating for people to get vaccinated. We do not have any vaccinated patients admitted to our hospitals for Arizona General. We've only ever had one vaccinated patient that was in the ICU for us at Arizona General, and we have had no vaccinated patients die at Arizona General. So we are really, you know, pushing for that vaccine, people to get the vaccine and save themselves. It's very traumatic for our teams to have patients who we've been here for a long time. They're here for 2-3 weeks, and then all of a sudden we have to put them on a ventilator, and the team knows the patient and their family, and the patient will, you know, beg the family members to get vaccinated, and it's just very traumatic for our teams, you know. So anyway, we appreciate the support from the community that continues to surround our teams, and stay safe, everybody.
Great, thank you for the update. That was fantastic. And like you, I think most sectors are dealing with it. I know our numbers are on the rise for our positive employees, and I can imagine all healthcare and law enforcement, fire departments, everyone's experiencing that, considering they are in the front lines of everything. So thank you to you and your teams for everything they do. We'll continue to push forward, but thank you very much for the update. I think kind of leading into that was just healthcare workforce in general. You know, I will speak a little bit on our company from the pre-hospital side. We are seeing, as Cynthia alluded to, an increase in the number of folks that are testing positive. We are seeing the numbers rise pretty heavily in Vegas. Just here in the Western region. Obviously, the new year just went through. They had a lot of people who went to Vegas. You know, we're not hearing anything yet as far as the hospitality side shutting down again, but we are starting to see people pull back. There is a rampant outbreak going on in Vegas right now that is impacting, I think, some of the hospitality as well as the healthcare sectors. Last time that happened, we as in Arizona were about 2 to 2.5 weeks behind them. So a lot of calls that I'm listening and hearing, either from the national level as well as Maricopa County specific, are saying that our bell curve is still going up, unfortunately. and they're anticipating a little bit of a hit in the next couple weeks. So if anyone else has anything to add on that, that's from my perspective on the healthcare side, but open to discussion and dialogue around that.
Tom, how's
Yes.
PD doing? Tom.
Yes,
Tom.
moving along. I know in talking with my fire counterpart yesterday, they have had a significant increase in the number of COVID cases of those that of their members working the trucks. I think they said 29 positive cases in the last 5 days, which collectively is a significant increase compared to same period last year. Overall in PD, obviously PD is probably about 3 times the size of fire. With that being said, I think a lot of the steps that we had taken to mitigate the COVID, the COVID issue last year, we've reincorporated over the last month. So for the most part, we have people that are, getting sick to a certain degree. In some cases, mild symptoms, and in some cases, they're not even testing just because they're recovering fairly quickly. So I haven't seen a significant impact here at the academy. We're getting ready to start another academy on Monday of 50, I think it's 58 recruits. So we're meeting with all of them today, and they're going through, they're getting, they have the option of being vaccinated here as well moving forward. So we're trying to mitigate a lot of those issues, both on the streets as well as in our contacts with the community and here at the training facility. Collectively, the police department's been doing really well. Society, on the other hand, seems like things have been with the holiday season. It was a very busy, very active, and in some cases, I noticed on the agenda you reference mental health. I can tell you that the root cause of criminal activity is very expansive. There is no one reason, and your agenda labeling mental health is certainly one of those qualifiers that I've recognized it as being a main cause for a lot of the activity that we've seen over the last probably 6 to 8 months. And one would have to surmise that it's a result of COVID and the impact it's had on our society and our social interaction and ability to. So overall, in a nutshell, that's kind of where we're at. I think our folks are doing a really good job in what we have to do, but we continue to work towards finding new and better ways of helping those that can't help themselves. So.
Thanks, Tom.
Yep.
Celine, can you talk about, Celine, are you there? Okay.
Yeah, I'm here.
All right. I had asked Celine to come on this call because obviously City of Mesa is concerned about the workforce issues and the lack of. And do you want to just talk about kind of what you guys are doing from economic development standpoint?
Yeah, so a lot of the companies that I'm meeting with, of course, workforce has been, the biggest challenge for them right now. Just finding that quality and skilled talent has been difficult for specific roles as well. But City of Mesa is working on a workforce strategy, and we're working with the county right now to put together some type of strategy. The parameters haven't been necessarily firmed up just yet, but we're trying to figure out how we can fund this and work closely with our partners to make sure that we're giving our employers the resources that they need and the support that they need to find these workers. I think a lot of the requirements that employers are posing right now will change a lot this year as well. I think a lot of employers are trying to get creative in the way that they're advertising their roles, the requirements, again, what they're asking for, and also partnering with educational partners as well, and trying to build a pipeline of ready to work students and make sure that they're kind of helping them form the curriculum for next year as well, to make sure that they're learning the skills that these employers need for ready to work workers. So hopefully we'll see a change in the next year with how we're doing our recruiting.
Thank you. Todd, you're muted.
I'll add one more thing. There's your dollar, Sally. One more thing that we have done from our company is we've coined a program called Earn While You Learn. It's a national renowned program that we actually brought to Arizona, and we're starting it in Mesa, actually, 2 courses. One is with AAES and the other one's with Mesa Community Colleges at the Mesa campus. And what it is we actually are employing and hiring individuals who have no experience in healthcare, and we bring them on and we actually pay for them to go through an EMT course. So we are paying not only for them to go to school to become an EMT, but we're paying for them as an employer of ours while they're going to school, because we know oftentimes the challenge is people have work-life balance, they have bills, obligations they need to account for, and it's oftentimes people are unable to dedicate full time to go to school. So we are paying these people at a minimum wage, which is $12.80 now, I believe. And then once they finish their educational program, they will cert up through the Arizona Department of Health Services as an EMT. We employ them as an EMT, and then they get a pay bump associated with an EMT wage. So 2 classes that we're looking to start. One is on the next week, the 10th, which is through AAES. And the other one is through Mesa Community College, the Mesa campus. And that one starts on the 18th. So we put that program together. I believe we had over 100 applicants for the program, which was great. So if anyone is interested or has folks that are interested, please feel free to reach out. It's another opportunity for us. I think, Selena, as you mentioned, to get people interested in healthcare, just looking at the gaps that we're seeing. Cynthia, you're seeing them, I know, for example, everyone's seeing them with nurse shortages. And really the goal is to get people who maybe never would have thought of healthcare as a career opportunity, and get them started, get them in the door, with the hopes of moving people from EMTs to medics to nurses, whatever it may be within the healthcare sector. So it's really a great product, a great program, fingers crossed. Hopefully we'll have 2 full classes and possibly more. So that's something that we're doing as a company to help the workforce.
Great.
That's a good program, Todd. If you could send me some information, I'll put my email on here that we can share with some of our PCT. Working with Maricopa Community College as well, the Mesa campus mostly, in skilling nurses to get them into our EDs, because we do have 14 EDs at the Arizona General Facilities. That's a lot of ED nurses, and I have like 59 open ED nurse positions right now. So we're working with Mesa Community College, try and upskill other nurses, and they are creating a program actually in conjunction with our team to do that. So, but we do often get PCTs that are looking for either getting into EMT. So I'll put my email, if you can send me that, that would be great.
Yeah, absolutely.
Todd, if you could send me that information too, that would be great. Thank you.
Happy to do that. Thank you.
It's great.
I think, Tom, you hit the nail on the head a little bit, and I know it's on here. Number 8 is the mental health component. And I think we can all sit here and say that we wish we could do more. And I think there's an opportunity to do more with mental health. So Sally, I'll kind of let you open the floor here and then see kind of where we go or get into it.
Yeah.
But I think I'll just kind of tie 8 and 9 together, because I think it's a topic that we need to just have a little bit more broader conversation around. This is me personally speaking, and maybe look at getting some speakers in around the mental health and what we can do. It's a huge component, and I think it's just starting, in my perspective, starting to gain the national attention it really needed a long time ago, not just for our healthcare workers, but for those who are suffering, and how we can work through getting people the mental health they need. So Sally, I'll kind of let you take the reins and go from there.
Well, I mean, Tom really kind of went where I was planning on asking him to go, because we're seeing it a lot as we're talking to businesses. there's kind of two themes, and it's the lack of workforce and then the mental health piece that's going along with that. So I do think bringing in a speaker or speakers to kind of address that would be good. I think that that also plays into the lack of workforce. You know, people have sat home and now, you know, that's what they're used to. So if anybody has any ideas, Jeff, you may have some folks that.
I have a couple ideas actually, so I'm glad you looked my way on this.
Yeah.
You know, last year at Copa Health, we had a program that we did. May is Mental Health Awareness Month. So we had a program that we did that was on awareness, and we brought in some former NFL players, NFL alumni guys, and we did some PSAs. And we've just started in the last few weeks kind of talking about what we're going to do this year. And one of the ideas that I had, and I talked to Norm a little bit about it, but we haven't pushed it forward any farther, is to get ahead of it. It's, in other words, not just make it in May.
Right.
We were talking about an event in April and say, get ahead of mental health awareness month. So we're going to be talking a lot about this internally. And fortunately, Copa Health has resources that I think can do some good. So I'll definitely talk to Norm, let him know that this is part of the discussion, and see if what would you like? Would you like to have someone come at the next meeting and talk about this, or you know, we want to have that discussion with Norm? I know you guys have.
Yeah, I can reach out to you and Norm offline, but yeah, I think I think it's probably one of the top topics that we should be thinking about right now. Tom, did you have some more input?
Yeah, obviously, with what we deal with on the streets as the law enforcement entity for the city of Mesa, and in partnership with our other agencies, you know, the academy that I run here, we train all Chandler, Tempe, and Scottsdale officers. And from time to time, Salt River or Apache Junction will have some recruits. So we have a pretty robust curriculum pertaining to dealing with folks in mental health and resources and such. And within the Mesa Police Department, we've had their crisis response team for a number of years, where we actually have counselors embedded with teams of officers that are well trained in terms of dealing with crisis response. So that's one caveat. So I just want to throw that out there, that I know the city of Mesa has been very supportive of our initiative in terms of our response to the community. But there's obviously a lot of other indicators and outliers. You know I personally experienced dealing with teenagers in mental crisis, both in my house as well as some of the kids that I've coached over the years. I'm sure a lot of others have. We've had an officer lose a child, teenage child, due to mental crisis. And I think all those things are very relevant because we realize just how widespread it is, right, in the communities that we serve. But I want to make this point because I think this point is very relevant for all of us collectively, whether you're in the healthcare industry, educational industry, any type of industry where we are collectively working to help others. First and foremost, my priority is taking care of my people and making sure my people have their resources. So I've been pushing for a wellness initiative, wellness program here at the Mesa Police Department that I'm hoping I'm going to be able to get off the ground come July. This is in conjunction with what the city has through their wellness side, but really focusing on both support, mentorship, and directive development for our employees' careers. Really, mostly from a holistic standpoint, so that they know that they're not alone. I mean, I've been out there at 3 a.m. dealing with crisis after crisis and feeling like, wow, is this it? Is this what the world's all about? So I want you to be mindful of that. Think about the folks that are in your work environment. If you're leaders within your work group, really promote that internally so that you can make sure you're there for one another, and effectively, we've got to take care of ourselves so we can take care of others.
Well said.
Sally, one other thing I'd like to say is that there needs to be a bridge what I'm thinking now is there needs to be kind of a bridge between what I was talking about and what Tom's talking about. There's the element of the awareness. If you need help, get help.
Mhm.
Okay, I need help. Where do I go?
Right.
So I think that to have a full program on this, that's, you know, kind of what I'm thinking out loud here. This is where I hope we're going to go this year, is not just if you need help, get help, but specifically resources.
Mhm.
So
Thank you.
combining resources is a great thing in a community too. Collaboration is a beautiful thing. So
Good. Yeah, Jeff, I'm sorry, I keep jumping in. I completely agree with you. I think that's a great point. Like every industry, I don't think it's industry specific. People are reluctant in our society to admit that when they need help. And I think that's why we need to develop those work environments where, you know, where people feel comfortable and confident in the support that they have. So that's why I'm really trying to facilitate that type of environment. I'm asking for a culture change here at the Mesa Police Department. In a profession that varies from city to city. I know it's going to be difficult, but my focus right now is for the city of Mesa. And I think collectively, if you focus on developing that support system first and foremost, so that people are confident and knowing they can reach out. And in many cases, it's not a lot of resources or care that they need. They just need an ear in some cases. So that's where that mentorship piece comes in for us. So thanks, Jeff.
thank you. You know, one other thing, Sally, just to throw one more thing out there, you know, I think a lot of you probably saw this player with the Tampa Bay Bucks, Antonio Brown. And when it first came onto the screens nationally and social media, everybody was laughing at it. But the first thing I thought about is he's had several of these situations, and these are mental health issues, and nobody has really reached out to him, you know, and said, hey man, what can we do to help you through this? I mean, Brady at the end of that press conference on Sunday said he hopes that everybody's there. But the reality is that the team cut him. They haven't officially cut him, but they said he's not part of the team. And at the point that he needs that team the most, not just for his body to catch touchdown passes, but his head needs the help, is when everybody's turned on him. So I've always thought that, you know, sports is a microcosm of society. Whatever happens in a locker room happens everywhere. And that's a great example, what happened last Sunday. So I think if we think about that going forward and how we can, you know, collaborate as a community and put some resources together in the next few months, it would be great for everybody. So I'm off of my soapbox. Thanks, Ellie. Thanks, Tom.
Oh, Jeff, you're right. It's for everybody at all ages, right? Because we have, you know, young kids at 7 and 8 years old dealing with some pretty tragic things, especially through COVID. And then, like Becky just put in, you know, we've got seniors that are taking their lives, you know, due to different stresses and health concerns. So, yeah, I think there's a big focus that this group can certainly put on this. And I think it's important. Any other topics for other speakers that we could bring in? Lori?
I'll just say, I know we've had Pamela Strowski speak before to the group, and she's, you know, been with the group. And I know I'm like dementia minded, but somewhere down the road to have another speaker on that, different areas that need to be dealt with. I'm dealing with some families that one family I even walked away from. I just couldn't do it. I just pulled my hair out. They don't get it. There's just so much education that's needed. And I know that would help the police department and the fire department too. I had a gentleman the week of Christmas that had been told by the fire department, you either find a different living arrangement or we're getting APS involved. And I don't fault the fire department because this man did not need to be living alone. But it brought him basically to tears, literally to tears, knowing that he had to make a change. So being part of the team that surrounded him and got him into a better place, I'm sure he's still mentally dealing with it and going through depression because he did not want to go into assisted living, but he's there now. So now there's a team that can work with them. So just education, education, anybody who can speak to that on dealing with seniors and helping them through. This is a very tough time for them when they have to do, and the people helping them. Sometimes I almost feel like, I could use some mental help because
Oh,
it's
sure.
so emotional. It is so emotional dealing with these people and what they're going through. So any speakers on that behalf, I think would be wonderful.
Okay. Sounds good. How about some of our new folks? Any questions you have or anything you want to learn more about? Lori?
I do have something now. I needed a minute to think. You called me. One thing that I would love to hear about resources on in the city of Mesa or private or public is driving for seniors. I run into so many residents or potential residents, people that, and I'm from the summit at Sunland Springs for those that might not know. And we're assisted living. And so we have a number of people that try to move in with their cars, which they're entitled to, but they should have had the keys removed years ago. And I don't feel like I have enough tools to help either the adult families or to help to point the people in the right direction on how to either say, excuse me, we all kind of have a frog in our throat these days. To be able to say, okay, well, if what are some accountabilities that you have? It's not just a matter of you feeling your pride that I can still have a pair of keys, but this is my kids being out there on the road with them, you being out on the road with them. If you've ever tried to drive on Signal Butte or get out of our, parking area, you got to be NASCAR ready. And unfortunately, we've had car accidents with residents because they don't have the reaction time. They don't have the wherewithal. If there were some additional parameters or checkpoints or something that we could point some people through to take away the personal feeling about it and make it be more factual. If you can pass this test, if you can go through this, then it shows that you can still, have the reaction time or make the decision making for driving.
What does PD do? I mean, do you guys have something in place or do you have somebody that you farm things out to?
Well, let me start by saying that we change positions here like we change socks. With that being said, I was in traffic as a lieutenant from 2010 to 2013, and we had recognized a number of collisions resulting or involving senior drivers.
Yeah.
So we developed a program back then that was well received. It got national recognition, a senior driver education program. And in many cases, it was focused on winter visitors, because as you know, from state to state, laws, signage, everything changes to kind of bring them up to speed on what is present here in Arizona. I can honestly say I don't know if we're still employing that same program. I can certainly reach out and find out. I believe I might have the curriculum at home in one of my boxes, but it's been a long time. But I know that we've done it, and I know that it was very well received. It was presented to a lot of the different 55 and over communities, as well as some of the RV communities to help with those winter visitors. So.
Well, that seems like it would be a great start for us.
Yeah, so let me look into it, and then I can email it to Sally what
Yeah, that'd be great.
she can distribute accordingly. Okay.
That'd be great. Thank you.
Yep.
Thank you.
For that, Lori. That's a really good idea. I mean, I think we all see it daily. Anybody else? It's a quiet group.
I think everyone's just getting back in the new year. That's what it is, Sally. We'll get more talkative. I get it. No, overall, just really good discussion. I think we're all on the same page, and that we need to try to figure out better ways to assist and help. And I think as we have more discussion on this topic, some other ideas may come out, flesh out, but I do appreciate the input and the guidance put forth by the group here. So thank you. That kind of leads us into our in-person discussion meetings. Obviously, we've talked about where the current situation is as it relates to COVID-19, coronavirus, et cetera. We would have liked to have had this in person, given the situation. I completely understand. We want to be accommodating, flexible with everyone and understand everyone's concerns, but also, like to get the thought process or gauge everyone's interest in, do we move forward with Zoom meetings? Do we look at hybrid? Do we continue to evaluate, or do we come back in person, or can we tentatively set, a date that we would try to get back in person? So just more of an open discussion, but kind of open to the group and hear anyone's thoughts or opinions, and we can go from there.
Okay, if nobody's going to speak up. I really want to be back in person, but I understand where we're at right now. So personally, I hate hybrid. I think it's harder than a Zoom call. Just, you're trying to talk to people in the room, but you're losing the people on screen. So I guess I would suggest that we meet a couple more months like this. And then, when things calm down, I do want to see us back in person. I mean, I miss seeing you guys, and I just think an in-person meeting is much better than little boxes on my monitor. But I do understand. And, Cindy's not going to be able to come. I think there's other people that, have been told they're not allowed to go be in person at this point. So I get that. But at some point, there's going to be a stop to this. Just my thought. Up to you guys.
I think we should just hang in maybe another time or two, and then hopefully we're like what's happened overseas. It looks like they spiked really high and then they've since dropped down significantly. So maybe this Omicron will do that as well, and we can kind of get ahead of it before we have another variant going around. So I think it would be great to be back in person. We were super excited to be able to start doing things again, and then Common Spirit tightened the noose on us. So we're back to everybody being, hybrid or Zoom call. So I another month or two, and then maybe we can hope that we'll be in person by April, or maybe even March if we're lucky.
That would be nice. That would be
Sally,
nice. Yeah.
habits die hard. So as long as you all don't make fun of me when we start meeting in person again, I'm going to continue to wear my slippers.
If you come, you can wear your slippers, you can go barefoot. I don't care. And right now, I wish I had slippers on. It's really cold in my office. We have no heat. Okay.
Style points for that.
Huh?
I said he gets style points for wearing slippers.
Oh, funny. Okay. Anything
Well,
else?
I got one more thing. You guys are talking about the folks telling people that they can't stay there anymore. And I actually recently went through one of those with my brother, who Mesa Fire PD came out and when they took him to the hospital, they said, you can't live here anymore because if there's a fire, you can't get out. And they later explained to myself and my sister-in-law that, once they know, they're stuck. They can't do anything. They have to follow the law. And they said that if, we didn't have a plan, they were going to have to report us to Adult Protective Services. And I totally get it. So maybe one of the folks you might want to bring on, because I honestly, I've only lived in Mesa 7 years, but I didn't know that Mesa Fire and PD had social workers. And I think that's a good thing. And I think that, I think we all know the leadership at Mesa Fire with Mary and the team. They're fantastic and they're people oriented. They want to help the community. So maybe one of those folks would be a good speaker going forward to explain the thinking behind it. And then one other thing, in my years in California I did a lot of work with the California Highway Patrol. They had a favorite saying. It was about driving, and they would say driving is not a privilege. You don't just get to drive. It's not a right. It's not a privilege. You don't get to just do it because you want to. You need to be able to, you're operating a lethal weapon. So that's one way that, you can look at talking to folks like that. Hey, it's a lethal weapon. It's what we all heard in driver's ed when we were 16 years old. Or some of us did, I guess. Some of you maybe not had done driver's ed, but okay, I'm off, Sally. Sorry.
Thank you, Jeff.
I think all good points and well stated, Jeff. Thank you for that. So looking at the agenda, I think, the next meeting is scheduled for February 3rd. I think we're all in a consensus. We probably want to keep that on a Zoom for now. And what we may want to do, Sally, is just put out, marches as well in Zoom and look to April as really the first one as a possibility to get back in person. I don't want to have to keep changing it or making people, are we doing Zoom or in person? I think
Sure.
I think let's do February and March in Zoom, and then we'll reassess maybe at the March one with the anticipation of hoping to be back in person in April.
Sounds good.
Sally, hopefully by, and Todd, hopefully by February, our workforce strategy will have materialized a bit and I'll have more news to share with you all. And maybe I can get one of our PMs who's leading on it to come talk about it.
That'd be great.
It's
great.
Awesome. Thank you.
And looking at the agenda, I think we've hit everything. So if anyone doesn't have anything else to say, I think we're good. We'll conclude this meeting and look forward to seeing everyone February 3rd.
Awesome. Thank you all.
Thanks,
Good to
everyone. Have
see
a
you.
great rest
Stay
of your week.
healthy.
Bye.
Bye-bye.
Bye-bye.
Stay connected to Mesa Chamber social media, email newsletters, Monday morning message, and mesachamber.org to always know what's happening at your Mesa Chamber.